Where the art of medicine is loved, there's also love for humanity. My name is Zama King McClung. It's Sanbonani, hello, hi, and welcome to the consulting room. Join me as we take a journey as we unravel and tackle the mysteries of the medicine world. Today, I have the specialist physician and medical oncologist, Dr. Shoba, who will be taking us on a journey of oncology. So, Dr. Shoba. You said you are a specialist physician and medical oncologist. What's the difference?
Medical oncology is a sub-specialty of internal medicine. So you have to be a specialist physician first in order to be able to study and become a medical oncologist.
Okay, and exactly what does an oncologist do?
An oncologist is a very wide field, but basically those people treat cancer. So there are basically three types of doctors in that field. We have your radiation oncologists. These are oncologists who use particles, subatomic particles, like protons and electrons, to treat cancer. And you have your hematologists. These are another field of oncology where they treat bone marrow and blood cancers. Then you have medical oncology. And these are doctors who also specialize in the treatment of cancer using chemotherapy, targeted therapies, monoclonal antibodies. They also treat solid tumors and hematological blood and bone marrow and lymph node cancers.
Okay, Dr. Shoba, that sounds very broad. So I just want to quickly ask, can a normal doctor be able to detect cancer, or do you have to go straight to a specialist? And in that case, uhamba masubunja?
Any doctor, any nurse, and any ordinary person can know when they have cancer. Because cancer is simply an abnormal growth. For example, in breast cancer, men and women, they get breast cancer. Everybody knows how your breast feels like. If you feel there's a mass, something that was not there.
True.
You know, as an ordinary individual, then you can go to the clinic, you can go to the hospital, you can go to a GP, then you can start the testing and know that you can prove that it is cancer and get referred appropriately to an oncologist.
So usually what test does a person do before they go to treatment and find out what kind of cancer they have?
The most important test is whatever growth or tissue or cell that is supposed or thought to be cancerous must be seen under the microscope. That's the most important thing. We need evidence in terms of tissue or cells or whatever we think is cancerous. You must see it under the microscope. You can't say, oh, I've got something, I think it's cancer, therefore I must start treatment. No, you need a microscope.
So basically, Dr. Shoba, it's a matter of I'm not feeling well. Because let's take a normal person who doesn't know anything about cancer. I think about who's with cancer, they think it's a death sentence. But you go straight to your normal doctor and then they refer you, or can you say, because we use Google nowadays, do you go, we are an oncologist, or you only refer to an oncologist?
Yes, oncology is a very high level kind of specialty. So it becomes difficult when you go to an oncologist without a referral, because there are certain things that must be done before you see an oncologist. So I've mentioned that you must have tissue diagnosis, you must have imaging, and a few other tests, and those things must have been done coming to an oncologist. But yeah, well, ngicabanga ukuthi njengala siphila khona nje South Africa, mhlawumbe nakhona la emakhaya uBangela nakuphi nakuphi, avela wekho kama-oncologist ungavele uyiyeleke senoqala khona kwa-angiqhubeleke mangayona i-cancer kuyona makuyiyo yiyo kodwa-ke ngokomthetho kufanele kwi-oncology uthunyelwe either a GP or other specialists.
Okay, so you're a medical oncologist. So can you just quickly take us through your journey ukufunda kwakho uzuzu specialize in medical oncologist? Kwahamba kanjani?
To become a medical oncologist, you obviously have to do your basic degree, which doctors do, and you have to satisfy all the requirements, internship, now they have community service, you have to be a medical officer, and then you become a registrar. That is when you start your training to be a specialist physician. Then you become a specialist physician after 4 years of that, which is a master's degree or a fellowship of some sort. And after that, you have to add another 2 or 3 years to be a medical oncologist. So that's how the journey normally goes. Unfortunately, in South Africa, medical oncologists can only be offered by the University of the Witwatersrand in Johannesburg and the University of Pretoria, and all these other universities do not offer medical oncology. UKZN, Cape Town, Stellenbosch, you name them, they don't have medical oncology. As a result, we have very few medical oncologists in South Africa, about 20 of them only. So it's a new field. In the world, in South Africa, it's only done in these 2 places. Yeah.
Okay, now I need to know, seeing how rare it is, when at Dr. Shoba, how did you find out about medical oncology?
Fortunately, I did my undergraduate degrees at the University of the Witwatersrand. So we knew that there was such a thing as we were studying there. Then I did my specialization in telemedicine in the same place. So that's how I got to know about it. Because I was there by luck.
There you have it, Babogeli. Sometimes luck does take you everywhere. Let's quickly go to an ad break and then we'll be back with Dr. Shoba as we talk more about oncology. Welcome back to the consulting room. Uzama, as we break down and talk about oncology with Dr. Shoba. Before we continue with the interview, please check us out on Facebook and all social media platforms on the Consulting Room and Vertebra Productions, where we'll and see who we have up next on our lineup. Before the ad break, there's Kulma Dr. Shoba, and we are speaking about how rare the field of medical oncology is. And if I'm not mistaken, facts say that we only have about 200 medical oncologists in South Africa alone, and only 20% of those people are in the public field, public sector. Why is that?
We have 20 medical oncologists.
20?
Not 200.
Yeah.
We have 8 black medical oncologists in South Africa. 8. I can give you the names.
Yo.
In my hand, and there are a few others, Indians and white people, and all 20 of them are working either in Sandton, Parktown or Pretoria East, and there's not a single one outside of Parktown, Sandton, Bryanston, Pretoria East. I'm probably the only medical oncologist in KZN. So yes, we have more radiation oncologists in South Africa. They are not enough. They are far from being enough. But we have more, maybe the 200 number, radiation oncologists. But medical oncologists, there are 20 of them.
And that means because the number is so low, does that mean you guys work with the private sector and the public sector as well?
Well, I mean, maybe 2 or 3 or 4 people that work in the public sector that I know. Everybody else is working in the private sector, and a few other people in England and Canada. They're trained in Johannesburg and Pretoria. Abaningi abantu basebenza in private. Yeah.
Dr. Shoba, do you think that the government can do anything to help increase the numbers, and also and get medical oncologists into the public sector?
Well, the government has the resources. You know, the government has the money. The government controls the training institutions, but there is no political will, or there is no awareness, or because, well, the government is not training medical oncologists. There is no real focus on cancer in South Africa generally. Their government does not care. Let me use the word about cancer. Maybe they care more about TB and HIV, but cancer is one of those diseases that selele muva. Futhi mayaphathi cancer mhlawumbe uzovele ufe, especially uma usemakhaya noma ngabe early noma ngabe late uzofa. Vele ngoba azikho ibhedlela nasebhedlela bekho odokotela be-cancer futhi akekho umuntu utrainwayo. So South Africa, despite ukuthi there's so much that the world has done in fighting cancer, South Africa cancer is still a death sentence. Not because there are no treatments, because there are no doctors. And where doctors are, there are no treatments.
It's scary to hear you say that, Dr. Shoba, because in all honesty, it's true. Most South Africans, we don't know how to deal with cancer. I know for a personal fact, she was recently diagnosed with leukemia, which for us as a family, we thought it was a death sentence. Once a month, she has to travel from Emadonela to Mseleni, so Mseleni, ezengwelezane, so engwelezane, kwilaye eThekwini. And still then, masimbuza kwenzakalani, naye akwazi ukuphendula ukuthi odokotela bafike bathini. What do you think is happening in the government sector? Because if there's so few doctors, are government hospitals giving adequate help to cancer patients?
Asikhulume ngento eseduzane isibhedlela sila eMpangeni eNgwelezane. eNgwelezane abantu iNgwelezane ibheke abantu cishe about 4 million. So le emkhanya kude uziboshale iNgwelezane sona sibhedlela esikhulu salabantu abazigidigidi. Kodwa akekho udokotela we-cancer eNgwelezane. Nhlobo. Abantu be-cancer babonwa umuntu oyi-MO, medical officer, ongena training nhlobo. Ongasupervisor umuntu. Mawusuka nje le mhlawumbe yalingana uzeNgwelezane one-cancer ufikela kumuntu oyi-GP. Ongana supervision. Uqashe odokotela basuke eThekwini kanye ngeviki. Bafike bahlala i-hour. Babone yonke le nqwaba labantu ngabazobona. Kangakuthi ke nje uchaza nje ugogo apho usuka le. Uthola ukuthi usuka le umsombuluko. Uyoza buye ekhaya ngoLesihlanu. Kade esemseleni adlule eNgwelezane afike eThekwini ngoLesithathu. NgoLesithathu eThekwini afika abonwe udokotela ongaqeqeshiwe mhlawumbe intern noma i-MO noma i-ComServe noma i-registrar ithathe mhlawumbe igazi ithi gogo bobuya futhi ngesonto elizayo akenziwe lutho lo uzobuya futhi emva kwamaviki amabili kuthiwa imiphumela yakho yegazi ithi hayi sisawufuna udokotela ke oyi-consultant ye-oncology asitshele ukuthi senze njani ubobuya ngesonto elizayo. Kangakuthi ke abantu bafaka endleleni. Uthola ukuthi mhlawumbe udokotela bambonile bahlabisa ukuthi une-cancer odokotela bakhona. Hayi akaye Albert Luthuli. Kufanele adlule eNgwelezane. eNgwelezane enze i-CT scan. Ikho i-CT scan njengoba kubani manje kufa kwakhe. I-CT scan izoyenza mhlawumbe ngoJuni eNgwelezane une-cancer njalo. Ayilindeke i-CT scan yenziwe ngoJuni. Mayisiyenziwe ithunyelwe Albert Luthuli bese Albert Luthuli hayi mletheni ngoSeptember. Alindele lo September usaphila afike ngoSeptember kuthiwa hayi ziphelele zonke izinto gogo cha yonke into ihamba kahle kodwa ayikushoda ukuthi bakwenzanga i-bone marrow hamba kubuyele eNgwelezane bakwenza i-bone marrow ubuye ngoJanuary. Akalasha nje lo muntu usahamba nje ama-test ukuthi angene mhlawumbe uzokuthiwa azafika udokotela azomlapha ngokuthi ngonyaka ozayo lapha asakwazi ukuhamba usegulela ukufa ukuthi hayi lo muntu usegula kakhulu uma sithi siyamlapha vele uzovela ngohlobo asifike simnyela hambisele ekhaya ninikele imorphine nimnikeze ipanado usenhlungweni nimnese nimthande vela ngeke saphila asho.
Yo.
That's the typical journey of a cancer patient in South Africa.
Yo, Dr. Shoba, it's actually quite scary. But on that note, la in South Africa, what are the common cancers, noma cancer ejwayele ukuphatha abantu?
La eMzansi, njengawo nje amazwe mhlawumbe asathuthuka noma namazwe asephansi noma amazwe abantu abamnyama. I-cancer ebulala abantu kakhulu eSouth Africa abesimame i-cancer yomlomo wesibeletho cervix. Amadoda avame ukuhlushwa wona i-cancer yomphimbo, i-cancer yethumbu, ne-cancer ye-prostate. Ilawa ama-cancer ahlupha kakhulu njengakuleli izwe lakithi. Bese la izweni lakithi sinanenkinga ye-HIV, kube khona ama-cancer amadlala negazi ama-lymphomas nawo andile. Kodwa nje into enkulu kakhulu i-cancer of the cervix, which is preventable because abantu abenza ama-pap smear igenge abantwana abancane bano 12, 13 to abagomele HPV. Amadoda ahamba check ama-prostate, ayeke notshwala, ayeke nokubhema ugwayi. Zonke lezi zinto kubalekela i-cancer yomphimbo qoqoqo. I-cancer ye-prostate iyacheckeka nayo egazini. So they are preventable, but here we don't have primary healthcare programs.
Ngiyangithusa actually because ngendlela usho ngayo usho nje ngathi into elula nje that anybody can prevent, but why is it le mindset thina sinayo? Siyasazi ukuthi nje waba nento ethi cancer one into ekude kunawe uyayithola mhlawumbe angazi ngophethe ubani noma into kanjani. If cancer is so easy to prevent, then yini eshodayo? Is it because asinalo ulwazi, or is it because ngoba dushile eqaleni ukuthi it's not something that our government is focusing on?
I think that's the most important thing. Njengoba sesishilo ukuthi umuntu uma kuthiwa une-cancer, isencane i-cancer abe nenhlanhla ukutholakala. Ake i-cancer yebele nje. Umama uyageza uyeza ukhonto engekho engahambi kahle ebeleni lakhe. Uzoqala eklinikhi. Hayi eklinikhi basho lokho abakushoyo bamsele bayele. Emva kwenyanga ezintathu umama bothi iyakhula lento. Ahambe mhlawumbe esibhedlela esinjengolezana. Bafike ngolezana bathi nakhona bamsele kuphela izinyanga ezintathu kuyima kuthiwa angeke siyibiopsy lento. Eyithathu le biopsy ithunyelwe eThekwini. Kuphele futhi izinyanga ezimbili usathiwe silinda ama-result iyakhula njalo i-cancer. Abuye ama-result ukuthi hayi i-cancer ihambe kangakanani nasenzele i-CT scan, umshini we-CT scan ufike. Asazi ulungiswa nini. Ulungiswe ukuthi hayi wena mama sokwenza ngoDisemba i-CT scan yakho. eThekwini bathi sifuna i-CT scan before siqale simlaphe. Uyafika umuntu la kusefanele lashwe khona ngonyaka ozayo. Uvele i-cancer isisebuchosheni, sisemathanjeni, sisesibindini, sisemaphashini vele akasakwazi manje ukusuka kwahlabisa gibela yolala engolezana vele asena manje siyagula avela shonele ekhaya.
Babuyile bakhaya, we really hope that this is going to be super informative. Kini ukuthi sukumani if kunento ongayizwa kahle, or just find general information. We have the internet. Find out more about this. We're glad that we have people like Dr. Shoba, who are such a rare find right in our town in Bangini. Right now, I have a few questions. Hey, Kamoga, straight from Nina. And if you make sure to like and follow our page, The Consulting Room and Vertebra Productions. So Dr. Shoba, I have a few questions from our viewers who wrote this in, and we'd like you to be guests to answer them. So first question is, what are the various stages of cancer and what do they mean?
I-cancer njengoshilo ukuthi into emilayo noma ekhulayo emzimbeni womuntu noma egazini lomuntu kodwa emilayo noma ikhule ngokungemthetho noma ngokungalawuleki. So makukhula ngama-stages kukhulwa nokuthi sikhule kangakanani noma isihambe yafikaphi. Ama-stages ukuhlukana kwama-cancer awafani, kodwa stage 1, 2, 3 usually kuba ugcine ku-4. kodwa ke ziningi indlela okuhlukaniswa ngazo kodwa soke nje kusho ukuthi sekungakanani ukufa emzimbeni noma ke sekuhambe kwafika kuziphi izitho zomzimba.
Okay, so khona lezi ade sikhuluma ngazo, the general and most common cancers that we have. If mhlawumbe ungasicacisela kuwona, what are the general signs? Specifically, we were talking about prostate cancer, throat cancer, and breast cancer. Like the typical symptoms and signs. Nomuntu mayethi sekhaya engachecka kubona ukuthi mawuthi uyasola engachecka kanjani for ukuthola usizo.
Cancer yebele abantu mabe baye bafundisa emaklinikhi ukuthi umuntu azithinte ibele lakhe yazi ukuthi awekho namagulo ukudla khona nasemakhwapheni ngoba cancer yebele isuke ebeleni iphuma ekhwapheni. Uze ukuthi azikho izinto ezikhona zamagulo ukudla ekhwapheni noma ebeleni qobo lwayo. Kuya ebhedlela kwenziwe ama-mammogram phambi kokushaya isithombe salo ibele kubonakala ukuthi azikho into eziphakathi mhlawumbe emva konyaka emibili noma emithathu phambi kokubheka lokho. Cancer yesibeletho nayo futhi kuyakuthiwa umuntu angenza i-pap smear noma kanye nje eminyakeni emihlanu enza i-pap smear kubonakala iqhubekayo. Ngeshwa-ke lawo amanye ama-cancer akulula ukubheka ukuthi isikhona noma yini ngoba i-cancer yomphimbo nje umphimbo lokugwinya. I-cancer ebuhlungu ngoba uzibona ngoba kungasehli ukudla ukuthi khona. Hayi ngizwa ngathi kuyabambeka sivele sikhulile vele siyinkulu sekulate vele ngiyashwa ayikho indlela yokuthi ubone lokho kuseheli kodwa ke phela siyazi ukuthi abantu abaphathwa leyo nto abantu ababemkwayi abantu abaphuza utshwala mhlawumbe lezo zinto abantu kufanele bahlukane nazo ukuze bangasenkingeni ukuphatha leyo cancer leyo.
And let's just deviate from the questions. I think people don't talk about it, prostate cancer. I think cancer, can you just elaborate your prostate cancer and our symptoms?
Prostate cancer is cancer kabi ikakhulukazi kubantu abamnyama uma iphethe abantu abamnyama bangubani olaka. Ngiyashwa ke futhi njalo azikho impawu ngathi nasi seyingiphethe. Yiyo ukuthi indoda mayihlanza u40 ijwayele ukuyocheck igazi, ngoba check igazi i-check prostate cancer. Umuntu esedlule ko40 years kuyale phezulu. Kodwa azikho impawu ngathi hayi izolalela lokhu nalokhu. Ngaphandle manje sihambile-ke sifike emathanjeni ukuthi ekubuhlungu iqolo hey uthola sisemaphandleni bese kule emathanjeni bese kulate.
This is the last question for our viewers, and I think sonke futhi siyawuthanda futhi ngokuya sithusa leli igama elithi stage 4 cancer. We normally hear that term and think death. What is going through somebody's body at that time, and is there a point of return? Basically, can one heal back since we are stage 4?
When I call my cancer no stage 4, sikwazi ukuthi uzolapheka ube right njengama lymphomas. Athize siyazi ukuthi noma stage 4 akunankinga yonto leyo ama-cancer seminomas, dysgeminomas and such cancers stage 3. Mhlawumbe ne-cancer ye-colon ithumbu siyandile i-cancer yethumbu in young black men. You know, sazi kwenziwa yini lokho 20s, 30s, 40s black men are having cancer of the colon. Mayisiku stage 4 mhlawumbe mayisahambe mhlawumbe afike esibindini noma yangaba nkulu nakhona we can still reverse it back to stage 3 ilapheke. Kodwa masifike ku stage 4 i-cancer ukujwayelekile isuke sekukwandisa iminyaka noma ukwandisa izinyanga zokuphila ukuthi ungashoni kusasa. Kodwa masifike ku stage 4 isuke isikhathi esiningi isuke ingasenakulapheka iphele.
There we have it. Stage 4 might not necessarily be a death sentence, but make sure that you get the help you need. Let's quickly take an ad break and I'll be back with you shortly.
Sometimes you don't die because of the pain that you have. You die because of the support that you lack.
It was my eldest daughter's 40th birthday party. When she heard the news, she ran away. She absolutely ran away from the doctor.
The brain cancer was starting. The situation was very, very bad.
Having cancer was really hard for me. I became very drowsy. I had a headache most of the time. I had to miss school.
We had no hope. Even the understanding between me and my wife was sour. We were accusing each other of not doing enough for our child.
As a parent, you want to love your child, fix them, look after them, and you are really challenged when the livelihood and the health of your child is not in your hands. I can't imagine anything worse.
He was diagnosed with lymphoma cancer, stage 4. He had 4 cycles of chemo of 5 days each. My daughter's medical aid were exhausted. There were no funds left.
We experienced the financial problems because Durban is a bit far.
There is a huge challenge for families due to the location of oncology centers because you're traveling hundreds of kilometers away from home. And if you think of the fact that we can have a nice place for you to stay while you're going through this and people that are in the same boat as you, it's an honor that we could be able to provide this to so many families.
Because I had a long way to come from Port Edward to here, so they provided me with a place to stay. It made me feel very happy.
We have just over 20 cancer care centers across the country with social workers and nurses that are doing incredible work.
When I was in hospital, they came to visit. They made me feel comfortable.
Joan started me with knitting to help me to get through everything. And I must say that therapy helped me a lot.
Having that counseling support and the information and the education plays a major role in the family's acceptance of a diagnosis and helping them to have coping skills throughout the process.
This center played a great role. Those financial constraints that we had were reduced by this place.
There are so many families that can benefit from our involvement, and we can just reach more families and more people. We have wonderful community members who bring us food parcels, which just kind of takes a bit of the burden off.
If ever this center could be established in other places, I think many people would survive.
We had a scan and the cancer was gone.
Even now, the relationship between me and my family is so wonderful, wonderful, wonderful.
I just would like to say thank you for Cancer TLC for standing with us throughout this whole journey.
We say thank God for rescuing our child. We also thank the place called Cancer TLC. The good spirit is hovering over here. It's wonderful.
There is a clip from a representative from Cancer where we asked them a few questions about cancer and the organization itself. Dr. Shoba, we are about to enter the last segment of our show, and I just have a few questions for you. I think these are everybody's, after all the information we've heard today, it's a burning question. What measures can be taken to prevent such illnesses?
Well, akulula kodwa ke mhlawumbe singasho ukuthi abagome abantu bagomele HPV, BCA cervix, abantu abezama ama-pap smear. Abagome abantu bagomele i-hepatitis B virus, i-cancer yesibindi. devastating cancer. Abayithinte abantu emabili abesilisa nabesifazane. Mawukhona umuntu akuzwayo malungile ebeleni akasuku. Thirdly, amadoda over 40 awa-check i-prostate. Egazi. So those and mhlawumbe asike nokubheka. Kwaye usile kwaye bangayikhensa yaqhoqhoqho, bangikhensa yolimo, bangikhensa amaphaphu, bangikhensa isisu, bangikhensa pancreas, kwaye banga yonke inkinga emzimbeni.
Usashaleya kwaye baba, there's this new phenomenon I think yonke generation is ngayo, which is vaping and the happy baby. Now it doesn't have the same effects as ukwaye.
Sisazobona phela ngoba yitsha lento uqhuba unyaka ukuthi yona idala miphi impumela emihle. Ngoba lokwaye it took many years and 40 years of study ukuthi kuthiwe hayi ukwaye udala cancer. Kodwa abantu bebemanje bekumekile uadvertise nasemsakazweni kuthiwa imali ngofuna ukuba glamorous uveze zonke izinto ezinhle ngokwaye. It took a number of years. So now all over vaping is born in 20 years. Just one of my victims.
So there's a new alternative cancer treatment. It's called low dose chemo.
Treatments for cancer have over the past 20 years undergone a revolution. Now we have even moved away from chemo. We have targeted therapies. We have monoclonal antibodies. We have tyrosine kinase inhibitors. The treatment for cancer for the past 10, 20 years has changed. So chemotherapy, yes, we started chemotherapy 70 years ago, 80 years ago, low dose or high dose or whatever. But we've moved on. We've moved on to magic bullets. We call these things magic bullets. Like heat-seeking missiles. We say, there is a cancer in the brain, let's just go for that one. Because, and just go for that one. Magic bullets, targeted therapies, the science behind the treatment of cancer in the 21st century is extremely complicated, fascinating. It's miracles. And those miracles cost money. And they cost good money, They simply there are cancers that will cost you a good R1 million to treat per month.
A patient?
Yes, per month, 100,000 every month. 100,000 for treatment. So they are expensive. They are available. Umphakathi kufanele usukume manje siye indaba kahulumeni nebhedlela. Umphakathi ufa usukume uthi siyazifuna lezi zinto. Umphakathi manje ufa usukume ngwelezana uthi ngwelezana abekho odokotela becancer siyabafuna kusasa ngeke sife sihleli. Community activism, because njengoba kwenzeka kwi-HIV, abantu i-HIV amaphilisi e-HIV ayidula kabi ifika, ayidula kabi. Kodwa basuka umphakathi wathi ngeke sife phela. Uhulumeni sukuma ehliswa ama-price wakhokha uhulumeni bonke alisedla amaphilisi. Iqala i-HIV ngo-2000 amaphilisi e-HIV ngenyanga ebiza 10,000. Isafika nje i-HIV. Kodwa manje sitholakala mahhala. Nalezi zinto ze-cancer umphakathi abantu mabesukuma besho bethi ngeke sife sihleli phansi bengekho ochwepheshe ingekho imithi. Sihulumeni baphathi bebhedlela sukumani kusasa ababe khona odokotela siyayifuna le mithi ayehliswe iprice.
Thank you so much, Dr. Shoba. Make sure you take a stand. You are able to make the changes you want. Dr. Shoba, thank you so much. If you want to get a hold of you, Dr. Shoba, where are your consulting rooms?
Ngisebenzela eKhan Clinic eMpangeni, abangidingayo bangithola lapho. Babuze lapho babanikeza inamba noma ne-email noma i-med clinic eNewcastle. So abangidingayo bangithola lezo ndawo ezizombili. Mabefika nje imibuzo ngami lapho kubaxhumanisa.
Uzweleke lapho. That was Dr. Shoba, available in Garden Clinic and Newcastle. Information will be at the bottom of your screen. My name is Zamaking Meklo, and that was the consulting room. Please make sure, stay informed, stay educated. Thank you.